Hi everybody, welcome to Health Wanted, the place to be for healthy living. Today, we will discuss reactive attachment disorder, RAD, including symptoms, causes, how is diagnosed, treatment, and more. Keep watching until the end because there is some truly valuable information for individuals with reactive attachment disorder or those who have a family member affected by it. Subscribe to our channel so that we can provide you with essential information to help you maintain good health and well-being. Let's now go to the video. What is reactive attachment disorder? Reactive attachment disorder, RAD, stems from early emotional abuse or neglect, hindering a child's ability to form strong emotional bonds with caregivers. This condition often results in a struggle to connect with parental figures or caregivers. Kids diagnosed with RAD struggle to control their emotions. They find it difficult to build deep relationships with others. Even in circumstances where their caregivers are incredibly loving and kind, children with RAD seldom ask for or display indications of comfort and may appear afraid or nervous around them. Who is affected by reactive attachment disorder? The majority of children with reactive attachment disorder are those who have been physically or emotionally abused or neglected. Although less prevalent, RAD can also occur in older children. Youngsters may be at higher risk of developing RAD if they possess a variety of parental figures, such as those in several foster care settings, were removed from their primary caregivers following an emotional relationship, suffered a number of horrific losses in their early years, having parents who failed to make an effort to build a strong emotional bond with them, and spent time in a facility without a caring parent figure, such as an orphanage. Unaware of the child's past, adoptive parents can find it difficult to connect with their new family members, particularly if the child exhibits any emotional instability. For an assessment, speak with your kid's healthcare practitioner if you are a new parent and your child exhibits signs of RAD or if you find it difficult to bond with them. What symptoms are associated with reactive attachment disorder? Every child experiences reactive attachment disorder differently. Infants and early children suffering from RAD often exhibit the following symptoms: being unable to communicate with others while feeling comfortable, loved, or joyful, staying away from physical contact and eye contact, displaying constant melancholy or discontent, or expressing fear or rage by throwing tantrums, and their tendency to transgress rules stems from their search for items in their environment that they can control. What causes reactive attachment disorder? Reactive attachment disorder in children has no known specific cause. According to studies, there may be a number of reasons why a child doesn't develop a close relationship with their caregivers, such as neglect or abuse, the youngster feels alone or abandoned; food insecurity, the child isn't getting the necessities; safety, the young person worries that they are in peril; poor personal hygiene, the youngster spends hours at a time wearing filthy diapers without having them changed; many caregivers, the youngster is unsure of whom to put their trust in; and caregiving that is inconsistent, the child's needs are only partially addressed, especially if they are unaware of when to anticipate rewards or consolation from their caretakers. When young children's basic needs are regularly met, they develop good relationships. The youngster and their caregivers get more trust as a result of this. A youngster may develop RAD if their emotional and physical needs aren't being satisfied. How is reactive attachment disorder diagnosed? Your child's doctor will ask you about your child's medical history and current symptoms in order to identify reactive attachment disorder. In order to gain a deeper understanding of your child's symptoms, medical providers may pose the following questions: has there been any abuse or neglect of your child? When did the symptoms start to bother you? What caught your attention right away? How are you and your kid communicating? What kind of living circumstances do you have? Does your child interact with other caregivers? In order to accurately diagnose your child and suggest helpful treatments, your provider may suggest that you and your child see a pediatric expert, psychologist, or psychiatrist if they suspect RAD. How is reactive attachment disorder treated? The goal of treating reactive attachment disorder is to help children and their caregivers rebuild afraid or uncomfortable interactions as well as emotionally sound bonds. Children who receive this emotional support are more equipped to form additional positive relationships in the future. Treatment regimens are beneficial for caregivers as well as for children. Possible course of treatment: Psychotherapy/counseling. A mental health professional works with the child's parents to develop positive emotional intelligence and lessen negative behavioral patterns that impede bonding. Family therapy. In this type of therapy, the kid and primary caregivers collaborate to create positive and healthy interactions. Intervention for social skills. The goal of this therapy is to teach the kid how to behave in normal social situations and with children of a similar age. Special education. School-based programs can assist students in acquiring the necessary skills to thrive in both academic and social domains, should they require them. Classes on parenting skills. Parents may pick even additional useful techniques in these sessions for handling their child's challenging habits. Are there complications associated with reactive attachment disorder? Children diagnosed with RAD are more vulnerable to difficulties during childhood and adolescence due to physical, emotional, and social neglect and abuse. These issues could include delays in reaching physical growth and developmental milestones, emotional disorders, including post-traumatic stress disorder, anxiety, despair, and problems controlling rage, eating problems, substance abuse disorder, problems in the classroom, learning and/or behavioral, relationship issues with adults or peers, later with partners, and risk-taking including things like early or frequent sex. How can I prevent reactive attachment disorder? The best defense against reactive attachment disorder is to make sure kids develop positive relationships with their parents or other key caregivers. Good relationships arise when caregivers foster stable and dependable relationships to strengthen family ties, make kids feel loved as children go through different stages of growth, assist them, and always attend to a child's basic requirements. What can I do to help my child develop healthy relationships? As their caregiver, you can support your child in forming strong relationships by setting boundaries. It's crucial to establish boundaries because all kids thrive in environments with regular routines. Establishing appropriate boundaries and non-physical punishment helps youngsters understand expectations and consequences for breaking rules. Children who experience less fear are better able to behave responsibly. Keeping your composure even when your child misbehaves. If your youngster is misbehaving, try not to react by getting upset. Instead, try to stay composed. Apply discipline in accordance with the guidelines you set and the rules your child is aware of. Spending time with your child one-on-one demonstrates a constant display of love and care. Engage them in conversation or song. Engage and play with them. Recognize that some children are more receptive to this kind of affection than others. Embrace, support, or display other caring and affectionate behaviors towards them as a caregiver. Refusing to show love and affection is never a justifiable means of discipline. In the event that my child has reactive attachment disorder, what should I anticipate? Reactive attachment disorder treatment helps many kids develop strong, healthy relationships with their primary caregivers as well as other people in their lives. Untreated children may be at risk for persistent emotional problems. Thankfully, treatment for mental health and developmental disorders, including RAD, is always available. Many adopted youngsters grow up to be extremely healthy and well-adjusted. Many come from foster care. Adopted children do not always suffer from RAD. A family history of emotional disorders is one additional risk factor for mental health and behavioral issues in children who have experienced considerable trauma. Prenatal drug or alcohol exposure is another risk factor for mental health and behavioral issues in children who have experienced considerable trauma. These variables can both lead to RAD. What is the duration of reactive attachment disorder? It is a lifetime condition to have reactive attachment disorder. Assisting the youngster with treatment and assistance can enhance their emotional and social welfare and help them form good relationships in the future. Should I schedule a visit with my doctor? In case your child exhibits any signs of reactive attachment disorder or struggles to form typical relationships, get in touch with their healthcare professional for a referral or assessment. Children with this illness have better results when they receive treatment and diagnosis early. It's critical to establish a relationship with your child and ensure their sense of affection. If your child is not developing a secure emotional relationship with you or their primary caregiver, get in touch with your regular healthcare physician. It's not a sign of a bad parent to seek treatment or advice from your provider. Rather, it provides an opportunity to forge a solid, wholesome, and enduring bond with your child. That's all for today, and always remember to stay healthy. Subscribe to the channel to receive regular health tips and advice. Thanks for watching, and we'll see you in the next video.